Hello everyone, happy Sunday, going viral today about respiratory syncytial virus. See what I did there? Also called RSV. We're going to talk a little bit about what it is, how it's spread, what you should watch out for, and how we treat it. So let's jump in. RSV, or Respiratory Syncytial Virus, is the most common respiratory virus that we see in pediatrics this time of year, especially in the pediatric intensive care unit. Now don't worry, not all kids that get RSV need the pediatric intensive care unit. In fact, the vast majority do not. Usually, RSV is just a mild cold. That's usually how we see it. If I get RSV or you get RSV, it's going to be a mild cold. But kids, especially children less than 1, are at high risk for getting sicker with the virus. And we'll talk a little bit about why that is. First, let's talk about how it's spread. It's spread through the air or through contact. So if somebody with RSV coughs or sneezes and it gets in your eyes, nose, or mouth, you can get infected with the virus as well. You can also get it from coming in contact with a surface that has RSV on it. Usually somebody with the virus is contagious for 8 days. It can be less than that, but 8 days is usually the max. And the peak of the virus is usually around day 4 to 5. Now, no kid ever reads the textbook, so some kids get better sooner than that, and some kids take longer, but that's a general average. So let's talk about why kids less than 1 tend to get sicker or can get sicker with this virus. The reason is because RSV is the most common cause of something called bronchiolitis, which is inflammation of the small airways. Bronchioles are the small airways, and itis is the root for inflammation. So bronchiolitis, inflammation of the small airways. Now, what is that? So usually people with bronchiolitis present with the congestion, they get a cough, but they have inflammation of those bronchioles. So these tiny little bronchioles, especially when we're talking about these kids less than 1, right? They have these tiny little lungs, these tiny little airways, and then they get inflamed, they get swollen, they get mucousy, and now all of a sudden they're trying to breathe through these tiny little straws. So in addition to the cough and congestion, they start to breathe faster. Sometimes they'll even breathe harder. So let's talk about what symptoms you should watch out for that should prompt you getting your child checked out. We talked about the virus causing you to breathe faster and work harder. Now that's the body's compensation to get air through those small airways so that the body gets the oxygen that it needs. When a kid is trying to do this, they will recruit, and we're trying to do this as well, right? You're at the gym, you're trying to get more oxygen. Sometimes you'll bend over in this like tripod position and really use your tummy to pull in air, right? Well, kids kind of do the same thing. So one of the first things that we'll see when kids are working harder to breathe is they recruit the muscles that are between the ribs. So you can notice pulling in a little bit between the ribs. We call those retractions. You can also see them below the ribs, so they'll start to pull in there as well. And when it gets more significant, they pull harder. And so you really see them pulling in underneath those ribs. They can use their tummy to breathe. Sometimes you'll see it above their sternum. So they really pull in here. They can use their sternocleidomastoids as well. So sometimes they'll bob their head. Sometimes you'll see them flare their nostrils as well. And all of those are signs that you should get your child checked out. A doctor needs to look at them, listen to their lungs, check their oxygen levels, see what their heart rate is. So definitely would get your child checked out if they have any of those symptoms. One of the other things that I usually look for is fever. Now, if your child has a low-grade fever, don't be concerned. That's pretty typical with the virus. I consider a low-grade fever anything below, I don't know, we'll say 102, 100.4 to 102. I'm kind of pulling these numbers out of the air, but low grade, 100.4 is over that is what I consider a fever. So less than that, I'm not concerned at all. Over that, but less than 1015, 102, that's okay. Pretty typical for the virus. Now, if your child spikes a higher fever than that, they're getting up to 104, 105, now I'm a little bit more concerned. That's not totally abnormal for the virus, but it's atypical. So I get more concerned that there may be a bacterial component on top of it, like maybe they have a bacterial pneumonia in addition to the virus. And that would be another thing that I would recommend, just getting your child checked out and having somebody look over them a little bit more thoroughly. The third thing that I look for is hydration status. So it's really important to keep your child hydrated during times when they have bronchiolitis. When you're breathing fast, you're actually losing a lot of water, a lot of moisture through your breathing. Most of your water loss, right, comes through peeing and pooping, but you can sweat it out too. And a lot of it, much more than we think, is lost in our breathing. And so when you're breathing hard and fast consistently, right, your child's running a marathon all day trying to breathe, they're breathing off a lot of extra water. And sometimes they will get sweaty because they're working so hard to breathe, and they can get dehydrated pretty quickly. So it's important to try to encourage lots of fluid. That can be tricky in babies who are super congested, can't breathe through their nose, then they have a bottle in their mouth, and they have a really hard time coordinating drinking and breathing at the same time. Sometimes they need to drink smaller amounts for shorter times, but do it a lot more frequently. That's something that you can try at home. But if you really feel like you're getting behind, they haven't had a wet diaper in 8 hours, that's another reason that I would get your child checked out as soon as possible. All right, let's talk about how we treat it. Drum roll, please. We do nothing. That was so anticlimactic, right? But seriously, we do nothing. Now that's a little bit of an exaggeration, but it's true in a lot of ways, because as scientists, we've done a ton of studies. We've looked at albuterol, which you'll know is the asthma medicine. We've looked at steroids. We've looked at breathing saltwater solutions. We've looked at antibiotics, all kinds of things. And across the board, the studies have shown that nothing really helps. What we do is support the child's body while the body fights off the virus. Now remember, this is a virus, so antibiotics don't help. Antibiotics only help with bacteria, not viruses. So if you go to your pediatrician and they do nothing, don't be upset. It's totally normal. That's actually what they're supposed to do. Just this month in Pediatrics, which is a well-known journal, really hard to get into. It is, the science is quite good. There was an editorial or an opinion piece about trying to encourage pediatricians to adhere to the guidelines, to not give your child medication that's probably not going to do anything. Now, what you can do is try to keep their nose clear. You can do saline drops and a bulb suction. You can do a nose Frida. That can help them breathe a little bit easier through their nose, which may then help, especially babies, help them eat and stay hydrated because they can breathe and eat at the same time. So that is something that you can try to do at home. But I understand it's frustrating. We like to fix things, okay? As pediatricians, we like to fix things. We want to make your child better. So it's really frustrating for us to say, oh, there's nothing that I can do. But there's nothing I can do. Sometimes I'll recommend, like, hold your child, steam the bathroom, like turn on the shower really hot, steam the bathroom, and hold your child in there and let them breathe that steamy air, or get like a humidifier, and maybe help to break up some of that mucus that's in there. But we don't recommend cough suppressants in kids because I always say better out than in. I'd rather them cough and move that stuff around and get it up out of their airways than suppress their cough and let all that stuff settle in there. So what do I do when a kid gets admitted to the hospital? Well, like I said, I support their body while their body fights off the virus. So that means hydration. Hydration is huge. If they're only requiring maybe a little bit of oxygen or a little bit of extra help, I can still allow them to eat by mouth. But sometimes I'm having to do IV fluids, or sometimes we even put a tube down from their nose into their intestines and get them hydration that way. Those are both great ways to do it. I always like to use the gut when I can. I always like to give them actual nutrition when I can. So a feeding tube is often the way that I go if they're not doing enough by mouth for themselves. We also usually give them oxygen. So if you're getting admitted to the hospital with RSV, usually we're trying to support the body so that's not working so hard to breathe. Usually that's in the form of oxygen. And if oxygen just through a regular nasal cannula, which is like a little tube with prongs that go in the nose, if that's not enough, then we can do a higher flow of oxygen, or sometimes we do masks, or in my world, sometimes I'm even doing a breathing tube. And in the PICU, all bets are off. So sometimes in the hospital, I will try albuterol, I will try steroids, but it's not recommended. There are a couple antivirals out there, but the data doesn't really support their efficacy either. So, like I said, it's really frustrating. But I hope that was helpful. I'm happy to answer questions about RSV in general. If you have specific questions about your child, please see your pediatrician. And for tips on prevention of viruses, you can see the post on my Instagram page. It's a picture of me wearing a mask. I hope that you have a happy Sunday, and I hope that RSV stays away from your family. Bye.